Hey guys, we wanted to get everybody together in one place. Obviously, Michael and I are not the most open people, so we thought the video would be the best way to do it, to get all of our thoughts and feelings out in one time. So everybody grab a drink and sit down, and here we go. So we want to start out with going all the way back to 2006, which was the month of my 18th birthday. As all of you probably know, I did 6 months of chemotherapy, so that was a lot of fun. And that was to subside or to lessen the lupus flare from the cerebritis and to get my body and brain hopefully back to working condition. So we did 6 months of that in 2006. And then we'll just fast forward all the way till February of 2015. By that time, I married this fool right here. And Michael and I have always wanted children. And I know I have, so we have talked about that. That's something we knew we wanted. So by that time, of course, we were both married. We were married, and I've talked to my doctors, my PCM, and my rheumatologist, and I was having some problems with an abnormality in my body, so they thought the best way to probably fix that is, at the time I was on birth control. They said, if I got off the birth control, that would probably help. So we thought, that'd be fine because we both want a family anyways. So in February of 2015, I got off the Implanon, which is the birth control. So I've been off of that for a little over a year now. And then also to prepare us for having children, we were talking, like I said, with my PCM and my rheumatologist. I also got off medications that might harm me or the baby, as the baby, of course, would be growing in the womb. So we went ahead and got off any medications that would harm the baby while growing. So after that, so that was in February, March time of 2015. I've been off some medications for quite a while now, so that took a little adjusting, as some of you know. During that time, Michael and I have been trying to conceive for about 6 months. So after speaking to my PCM and my rheumatologist, they both felt that it was important, because I have lupus, and most of you already know the complications with just having lupus by itself. They thought it is necessary to see an infertility specialist is also high risk. So when anybody with lupus or anybody with critical illness, they should see high risk in general when trying to conceive. So we met with infertility and also high risk. So in January of this year, we had our first visit with infertility, and that's at Duke. And it was just your official visit, just your consultation, things like that, family history. And he also wanted to run some tests. So the first test he wanted to run is called an AMH. And that tests how many eggs a woman is supposed to have based on her age. So I did that test, not a big deal. We got those test results back in January, and they came back, and the test shows that my levels were very low. But that's all it really showed. So once we got those test results back, he said, okay, well, we need to get a better look at kind of what's going on, because we're not sure. So we needed to do more tests. The tests we need to do to to identify, once we looked more into that, it's the FSH, estrol, and LH. And Michael can talk a little bit more about what an FSH is.
So you already talked about the AMH.
Oh yeah, so first he's going to talk to you about what the AMH is, because that's a little confusing also.
Well, after the AMH, they did the FSH test, the estradiol test, and the LH test. And the FSH test they do tells you exactly how many eggs are left for a woman, and the normal range is less than 10 for someone of Elena's age.
First is like, what is it?
And Elena's came back as 31.8. Just to give you some information on that, they said it's less than 10 for a normal woman her age is the normal reading, and 40 and above is for a menopausal woman. So that showed the doctor that the chemotherapy is most likely what has caused the damage to her ovaries, causing the eggs that she had, they're just completely gone. So her egg levels are extremely low for a woman her age. The condition is called chemotherapy-induced ovarian insufficiency, which is there's just a lack of eggs there.
Right, and so Michael's going to share with you some of the questions that we had once finding out the diagnosis. So as far as, once we got the diagnosis, about mid of March. He didn't want to tell us too much. He wanted us to wait and come in, and we had the doctor's appointment on March 24th. So he wanted us to wait to come in to discuss our options as far as getting pregnant, and things like that. So Michael can talk to you more about our one as far as the yeah. So he could talk to you more about that and the rates and things like that.
So the doctor gave us her diagnosis, and of course it wasn't good news. His estimates are that we have a 5% chance of getting pregnant naturally on our own, or a less than 5% chance. He suggested 2 treatment options that could possibly work for us. The least invasive of which is a low-dose estrogen patch, which is not very successful. Only about 1 to 2% of patients end up conceiving using that.
Yeah, and after speaking with him about the estrogen patch, and after speaking also with my rheumatologist, because obviously some of you know that having lupus and taking estrogen is not a good thing, because it, heightens and it will throw me into a flare. But because it is such a low estrogen dose, it will be fine. So that won't affect me. But because of my FSH levels are so high, they don't think it's going to bring me up to like an ovulating woman or a menstruating woman. So they don't believe it's going to work high enough and to be able for me to conceive a child. So they don't think it's going to work, but that's option 1.
The second option, which is probably his most strongly suggested one, which he says is a very good option, is to use an egg donor, which is about a 50 to 60% chance of conceiving with that. So with that, there's 3 ways we can find someone to donate an egg. We can go through their clinic, or we can use an agency. And so an IVF donor is they take an egg from another woman and use my sperm to fertilize the egg. Once the egg has been fertilized and once it's separated into so many cells, then they take the egg and they implant it into Elena's uterus, and 2 weeks later we go in for a pregnancy test to see if it took. So there's a 50 to 60% chance of that working. So as for Elena herself, the only issue that the doctors, any of them, see is her egg count. They think she's completely healthy, completely able to carry a baby naturally. It's just the egg issue.
And then later that day on March 24th, we met with Iris and discussed the same. After we got the diagnosis, we discussed the same things with her as well, and she agreed with the exact same thing that the infertility specialist said. So everybody's on the same page with that now. So kind of where we stand at this exact point, Michael has a semen analysis on the 4th, which is Monday, and I have a saline.
You have a uterus exam on the 12th.
On the 12th, yeah. So it's just like an inside ultrasound on the 12th, because I do also have a septate that they're a little worried about, but that's easily, so it's easily taken care of. We can easily take care of that. So they're just going to go in and take a better look at that, because that can cause miscarriages and things like that, but that can easily be taken care of. So I have that on the 12th. So that's kind of where we stand as of right now at this point, because you guys are our friends and our family, and most of you know like how much we want children. This means a lot for us because neither one of us, of course, are very open people, but this doesn't just affect us, it affects all of you, and we care about all of you and want to keep you in the loop. So we are going to continue to do videos like this, and journaling our process from here on out. So if you guys have any questions at all, feel free to ask us. It is very hard for both of us right now, so we're just kind of jumping in, and this is new to us just like it's new to you, but we love you all very much and we really do appreciate it. So, do you have any questions?
That's it. Thank y'all for everything.
Okay. Love you.